Urinary tract infections, or UTIs, are incredibly common. They occur when microbes, tiny organisms invisible to the naked eye, invade the urinary system. This system, responsible for producing and eliminating urine, includes the kidneys, ureters, bladder, and urethra. UTIs can affect any part of this intricate network. Imagine the urinary tract as a pathway. When working correctly, urine flows freely, flushing out any potential invaders. However, when this pathway is compromised, microbes can latch onto the tissues, leading to an infection. This can cause discomfort and, if left untreated, potentially serious complications. UTIs are particularly common in women due to their shorter urethra, the tube that carries urine from the bladder out of the body. This makes it easier for bacteria to travel up the urethra and into the bladder. While anyone can get a UTI, certain factors can increase your risk. These include dehydration, sexual activity, certain medical conditions, and the use of catheters. Understanding the different types of UTIs, their causes, symptoms, and treatment options is crucial for maintaining good urinary health. In the following sections, we'll delve deeper into these aspects, empowering you to recognize and address UTIs effectively. Most UTIs are caused by bacteria, tiny single-celled organisms that are everywhere in our environment. These microscopic invaders can enter the urinary tract and multiply, leading to an infection. Escherichia coli, commonly found in the intestines, is a frequent culprit in UTIs. While bacteria are the most common cause, other microbes can also trigger UTIs. Fungi, such as Candida, can sometimes lead to infections, particularly in individuals with weakened immune systems or those who have recently taken antibiotics. Viruses too can infect the urinary tract, although this is less common. Viruses are even smaller than bacteria and require a host cell to replicate. Certain viruses, like adenoviruses, can cause inflammation in the bladder, leading to UTI-like symptoms. It's important to differentiate UTIs from other conditions that might present similar symptoms. For instance, renal calculi, commonly known as kidney stones, are hard deposits that can form in the kidneys. While not an infection, kidney stones can cause pain and discomfort similar to UTIs. Understanding the different types of microbes that can cause UTIs helps healthcare providers determine the most effective treatment approach. Proper diagnosis and targeted therapy are essential for resolving the infection and preventing potential complications. UTIs often manifest with a range of uncomfortable symptoms. These signs serve as your body's way of signaling that something is amiss. Recognizing these symptoms early on is crucial for prompt diagnosis and treatment. One of the most common symptoms of a UTI is a persistent urge to urinate, even when the bladder is empty. This frequent urination is often accompanied by a burning or painful sensation, particularly during urination. The urine itself may appear cloudy or have a strong, foul odor. In some cases, UTIs can also cause pain or pressure in the lower abdomen or back. Blood in the urine, while alarming, can also be a symptom indicating a more serious infection. If you experience fever, chills, or nausea along with other UTI symptoms, it's essential to seek immediate medical attention. Diagnosing a UTI typically involves a urine test. This simple test analyzes the urine for the presence of white blood cells, red blood cells, and bacteria. A urine culture, which involves growing the bacteria in a laboratory, can help identify the specific type of bacteria causing the infection. Treating UTIs usually involves a course of antibiotics, medications that specifically target and kill bacteria. The type of antibiotic prescribed will depend on the bacteria causing the infection and your individual medical history. It's crucial to complete the entire course of antibiotics as directed, even if your symptoms improve before finishing the medication. Alongside antibiotics, your healthcare provider may recommend over-the-counter pain relievers to alleviate discomfort. Drinking plenty of fluids, especially water, is also essential for flushing out bacteria and promoting healing. Cranberry products, while not a cure, may help prevent UTIs by making it difficult for bacteria to adhere to the urinary tract walls. Preventing UTIs involves adopting simple yet effective habits. Staying hydrated by drinking plenty of water throughout the day helps flush out bacteria. Practicing good hygiene, including wiping from front to back after using the restroom, can prevent bacteria from entering the urethra. Urinating shortly after sexual intercourse can also help flush out any bacteria that may have entered the urethra during intimacy. If you're prone to UTIs, talk to your healthcare provider about preventive measures tailored to your individual needs.